What does a good mean in AI system? Next question is, which one should we choose?
You can have like the best AI model, but if it doesn't have access to your data that you're trying to work with, it's not going to be too useful to you. If you get 100%, something's wrong. Well, you could get a model that was 95% accurate and 100% useless. Don't trade on my data. They are legally obligated to not do so.
Hello, welcome to SpeechSage podcast. This week we are delving into what does a good mean in AI system. And I'm your host, Joseph Yoon, and we have today AI specialist, Noah Vandal. So we came up with this question because there are so many different AI platforms nowadays, right? And many entities are interested in healthcare also.
Yep, a lot.
So obviously the next question is, which one should we choose? Can you share your insight into what makes AI platform good for healthcare?
Yeah, I mean, that's a pretty broad question. And there's a lot of nuance to it. And this is something that like your security team would have to evaluate. The first thing, I mean, maybe not the first place, but one of the first places I would start, obviously, is your integration. If you are an existing healthcare platform, or maybe you're not even a healthcare provider, but maybe you're like a small business. I'm talking about basically any use case other than a personal use case. Probably one of the most important things that is going to be critical to effective AI use is how it can connect with your data. Google has decent AI models. OpenAI, they have the best. OpenAI and Anthropic right now currently have the best AI models. And then there are a few other players as well. I think of XAI. They're less of a player. Microsoft, they just today actually released a few models themselves that they've been training. And then there's a bunch of other smaller ones as well. But I think right now, currently the big three in the running for integration would be Google, OpenAI, and then Anthropic. And for in terms of just more generic. Now, the question is, though, there are some more specialized models, I think of like Open Evidence, that are more tailored for healthcare. A big part of making an AI work well in your healthcare practice is it being able to interact with your tools. We talked about this on an earlier podcast about context and how much context matters. You can have like the best AI model, but if it doesn't have access to your data that you're trying to work with, it's not going to be too useful to you. So again, there's a whole lot of nuances and more rabbit holes we could go into as to what is the best. But a lot of these different AI platforms, they offer really close to the best model. And what you're going to be more, like one of the first things that you're going to be more interested in is how can this work with the data I already have?
So you talked about importance of context in AI. So there's some platforms announced like OpenAI, the healthcare ChatGPT, and available free to healthcare providers.
Sure.
So that type of very specific effort, do you feel like it results in a better platform then?
Yes, I mean, I can attest to having used it in a clinical setting. I'm not a clinician, but a lot of times when you have a model that is more specialized for a domain, it can excel quite a bit more at that task. So I don't know exactly what OpenAI did for their one for healthcare, but I would imagine that they fine-tuned a model to have more healthcare-oriented responses. One quick example of this is there's a lot of AI models that are called speech-to-text or TSTT models. And what they do is they talk and then it'll transcribe. There's a very important metric with that is called word error rate, WER. And that's essentially when speaking, how many words do you get wrong? Well, when you and I are just talking in general as friends, not as a clinician or a machine learning engineer, our jargon is going to be pretty commonplace. That is one set of word error rates. However, if you're a clinician, you're triaging, or someone they're doing triaging for a patient, you're in the hospital, you're using a bunch of very technical jargon, medical terms that could easily be misinterpreted as something else. But because you're in that medical setting, if you make the AI model aware of the setting that it's being used, you can optimize for what words are being spoken, or for an LLM, which concepts are being talked about. And so that's where, if you use something like a specialized one, you can have better results because it was so much more specific to that task.
So is that related to the false positive and false negative minimization?
Slightly, I guess. One this is a very important thing that as a healthcare professional, you need to make the judgment call. What is more important or to get correct, a false positive or a false negative? Like with any statistical method, this is one thing we learned in machine learning. If you get 100%, something's wrong. And so check your training set, check your data. Are you training on the test set? Very, very suspicious of 100%. But so with that being said, if you do get 99%, where are your 1% of errors coming in? Should you bias towards having a false positive or bias towards having a false negative? Would you rather treat someone assuming that they have colon cancer and they don't, or would you rather not treat someone and they do have colon cancer? So these are things that, to some extent you have to make on a case-by-case basis. If you are doing something like a cancer diagnosis, chemotherapy is, you would know more than I would, but chemotherapy is extremely rigorous and damaging to the body. And so you want to be very certain that they actually have cancer. Getting a false negative is probably better than getting a false positive. Because then you would give the chemotherapy to people who don't have cancer. Right, which could be very worse. And you, in the process, you may miss some people that do have cancer, but maybe then you could catch it at a later stage, and that may be better. And that's a value judgment call that you would have to make as an entity or as a clinician.
So clinically, one example that we do is we waste a lot of money isolating people who are suspected to have tuberculosis, for instance, because it's very infectious. And so we err on the side of false positive when they don't have disease. Isolate them, make sure they don't have it.
Because the side effects for that it's minimal. It's isolation, but you're not damaging their body.
Inconvenience, but we could potentially prevent the transmission. So that would be a extreme case of being paranoid about the false negative, because we don't want to have false negative.
Right. That makes sense.
Infect everyone. But you are saying that in AI also, this is a very important concept.
In AI as well, and then again, this is where you have to some extent, a lot of these AI models, they have to be designed with the intended task in mind, and then you can optimize the data set or the training method to hit the target that you're aiming for. So,
but the along with that, how about the implicit bias against gender, race, and all that type of issues?
This is a really, really interesting topic, and it's not necessarily even an AI topic as much as it is a data set topic. I remember learning about this quite a few years ago in engineering school, but we were doing a project for we were trying to read carbon dioxide in the blood using some light sensors. But one thing we were doing preliminary research, and one thing we found was a carbon dioxide sensor in your blood, if you have fair skin, it works really great. If you have a lot of melanin and you're dark skinned, it's not going to be as good. And this isn't like a race issue, it's a melanin density issue, but those are things that you have to keep in mind, because if you are trying to serve anyone with their disease or with their condition, you have to keep things like that in mind. If you have genetic differences that make an impact in your data set, you should properly account for that. Another thing that happens in machine learning is you get like an imbalanced data set. Let's say, for the sake of an example, again, this is not a healthcare related. Well, no, I'll keep it healthcare related. Let's say you're trying to detect whether someone has blood clot in their brain versus, I guess, no blood clot. Let's say in your data set, you have 95% images with no blood clot, but then 5% images with a blood clot.
Yeah.
Well, you could get a model that was 95% accurate and 100% useless, because the model could learn implicitly that, oh, I get a really, really high accuracy in just saying that there's no blood clot. That's 95% accuracy,
Yep.
which would be true, but you don't care about that 95%.
Right.
You care about that 5%. I mean, the same thing could go towards those implicit biases. And those biases, it's not like the derogatory sense even necessarily. It's just, how is your data set managed? How are you properly making sure that the different classes that are important and relevant are properly accounted for and adjusted for? And then maybe if you have an imbalanced data set, what are you doing to compensate for the classes that are less represented?
That's kind of implicit in the patient population. But what about the different settings? So let's say AI is one engine, but clinic in Iowa may have a very different patient population or clinical setting from New York City.
Sure. To some extent, I don't know if we found a clear answer to that. This is me more dreaming or trying to see the future. I could see a future where AI is a little bit more evolving. Right now, when these AIs are trained, they're trained and you get what's called a checkpoint. And that checkpoint is what's distributed to everyone. And until that checkpoint is changed, you are using the same AI model. Some of the context may change, but the AI model itself doesn't change. In the future, though, I do see a more evolutionary type model or architecture where when you deploy it in Iowa, it does learn the patterns of the provider, of the patient on a daily basis, on maybe an hourly basis, as it interacts with the people. That way you do have a very much a custom AI specific to your use cases, how you operate, and how you manage your practice. We're not there yet, though.
Yeah. In evaluating those different systems, now it's from different perspective. I would think where the health system is regulated under HIPAA provisions. Do you see the security and privacy becoming an issue, or is that a differentiating factor?
Right. I think as long as your providers or your AI systems are following basic encryption standards, basic security, credential protocols, HIPAA compliance, SOC 2 is another great framework to follow in terms of making sure your data is transferred properly. You shouldn't have a bigger risk compared to any other type of cloud or internet's type of storage. There's a lot of people putting thought into this space right now, especially with the AIs becoming more powerful. A lot of systems are possibly more vulnerable. And some people are saying that there's a D-Day of 2030 for quantum encryption breaking a lot of our methods. That's a whole nother topic for a different time. That's an interesting domain. I mean, who knows what will happen if that is true or not. And if that is the case, I'm sure, there are already post-quantum encryption techniques that are being developed, not deployed yet though, in a lot of places. But it's again down to a lot of those basic security protocols.
I see.
That are just common practice for programming and computer deployment.
So a lot of patients, lay people, are afraid when they hear that their data is being used by AI system. Now, can you comment on when AI platform is used to analyze a data set, can they extract that data and use it for their training, or is it being done?
Right. Yeah, we talked about this a little bit more in depth with our cybersecurity one. But if you are using an AI provider and you have a signed agreement and you have the correct toggles on to say don't train on my data, they are legally obligated to not do so. Now, if you are using a service that maybe is less reputable and they have less trust, I don't know to what extent I would guarantee that your data is protected. And so that's where I'd just be very vigilant as to where you are putting your data. Are you putting it in some random free site that has a free AI? If you are, it's fine to test it out, but make sure the data you're submitting is you don't care that if it gets used and trained on or even exposed.
Mhm.
We've had a few instances in the last year of people vibe coding a website and they didn't put in the proper credentials and security measures, and a bunch of people's information got leaked. Again, that shouldn't happen ever in the healthcare space, but you never know. And so it is on you to do your due diligence as well to make sure that the data you're submitting is going to be protected.
And lastly, for the healthcare entities who may not have as much resources as a big, medical groups, say small to medium size, all of them are thinking about adopting AI and how to use AI. You explained to us that all different factors that to consider. Could you summarize and kind of make recommendation for such entities without the big resources under their belt? What would be your recommendation in approaching?
For how to get started with using AI in the practice? This sounds cliche and trite, but honestly, my biggest recommendation was use Claude or ChatGPT. I think a great place to start would be if you want to have like a clinical resource for medical documentation and literature. Open evidence is going to be the best place to start, I think. But you can get really, really far on ChatGPT or Claude or even the Google Gemini as well. And so if you're looking into more resources, I know we have some published blogs on our website that you can go to find some references. I also would say maybe just have a chat session with ChatGPT or Claude and look into where, for your specific use case, what you're wanting to use, where you could find some resources.
Can they try to contact you for advice?
Oh yeah, and feel free to contact us at contact@SpeechSage.ai. You'll get one of us at least.
Well, that was a very informative session, and I thank you for your erudite explanation on this subject.
Awesome. Well, thank you very much, and look forward to next time.
Yep.